Welcome to the channel Materia Medica for All. Today we talk about Baptisia tinctoria. The common name of this drug is wild indigo. It is a plant remedy and the mother tincture is extracted from the fresh root and bark of the plant. Baptisia is basically a short-acting medicine and is mostly suited for acute diseases like scarlet fever, typhoid, diphtheria and gangrenous complaints. There are many other remedies like R-salb, phosphorus, rustox and bryonia which are all indicated for zymotic diseases. But in these drugs, the disease progression is at a slower pace, but Baptisia is suitable in conditions where there is a rapid progress or rapid onset of the symptoms. Zymotic diseases mean diseases that are of an infectious or contagious nature. Baptisia is generally suited for people with a lymphatic temperament. It is used in diseases where the incubation period is not a few weeks but a few days. Therefore, the onset of disease is sudden and violent and the course of the disease is rapid. Let us now look at the mental picture seen in Baptisia. The first point, restlessness. There is a mental restlessness seen but too lifeless to move about. There is absolute aversion to mental exertion. There is an inability to focus on work and the mind feels very weak. The second point, there is a peculiar kind of mental confusion, confused as if intoxicated. The third point, stupor. They fall asleep while being spoken to or in midst of their answer. The fourth point, they cannot sleep at night. She feels her head and body are scattered about the bed. There is an illusion of divided personality. She feels that she is three persons. Let's summarize the mental picture. There is a restlessness with aversion to mental exertion, mental confusion as if intoxicated, stupor, falls asleep while being spoken to or in midst of his answer, and cannot sleep with an illusion of divided personality. Let us now look at some of the marked features of Baptisia tinctoria. The first most important point is great weakness, prostration, especially in the lower limbs. Wants to lie down, but on lying down, the parts rested upon feels bruised and sore. The second point, the face is flushed, dark red with a drunken expression. The third point, offensiveness of discharges. All discharges and exhalations are fetid and offensive. Stool, urine, perspiration, even the breath, mucus discharge from nose and throat, all are putrid and offensive. Next, we look at the tongue. It is coated white with red papillae and it has a yellowish brown discoloration in the center. The fifth point, there are putrid ulcerations of the buccal cavity, canker sores in the mouth. Ulceration is a marked feature of Baptisia and ulcers are dark red and sometimes associated with bleeding. The sixth point, there is painless sore throat with dark red, swollen tonsils, soft palate, and the parotids. The discharge is offensive. Another feature is constriction of the esophagus, can swallow only liquids, and the least solid food causes gagging. The eighth point, it is useful in dysentery of old people. The stools are very offensive, thin, dark, and bloody. There is soreness in the abdomen in the region of the liver. The ninth point, this remedy is indicated in diarrhea of children, especially when the stool is very offensive. The last point, and perhaps the most important point when it comes to Baptisia. It is regarded as the king of remedies in typhoid fever. It covers almost all the symptoms of typhoid and all stages of typhoid fever. According to J.C. Burnett, Baptisia is a king of remedies for typhoid and no other remedy can supplant it in the first stage. According to Borick, Baptisia in low dilutions produces antibodies to the Bacillus typhosus. Therefore, it raises the body's resistance to invasion of bacillary intoxication. Now with this, I come to conclusion of Baptisia. I hope this overview was useful and helpful in enhancing your learning process. Thank you for watching this video. Do like, share and subscribe. Thank you.